You don't have the authority to prioritize him, the hospital administrator said sharply. The young nurse held her tongue, choosing instead to quietly move the fragile veteran into a private room where he could find respite from both noise and disrespect. By evening, she found herself suspended without pay for her actions. However, before night fell, a four-star general walked through the lobby doors, with an order in hand that commanded immediate attention and compliance. If you believe supporting veterans is always right, command respect. Anna Brooks pursued a career in nursing, not for accolades or financial reward, but out of a genuine desire to help others. Her mission was straightforward, though it often became obscured amid the complex maze of hospital procedures, insurance policies, and administrative agendas. At 28 years old, she possessed enough experience to navigate the system, yet remained idealistic enough to think that she could make an impact on individual patients' lives. That Thursday afternoon, at Riverside Memorial Hospital's emergency department buzzed with its typical organized frenzy as gurneys filled the corridors. Monitors emitted their consistent beeps as busy staff hurried between the curtained cubicles. Anna had just completed her 5th consecutive hour without a break when she spotted him, an elderly man sitting alone in the waiting area, slightly hunched over in his chair. Unlike other patients, who were absorbed in their phones or browsing through outdated magazines, he sat there motionless, one hand on his chest, and the other clutching a well-worn army cap. His breathing appeared strained, yet his expression was stoic, revealing no sign of discomfort. Despite her clear discomfort, Anna approached him with a clipboard in hand. "Sir, are you all right?" she asked. Henry Dawson, 86 years old and possessing pale blue eyes that had witnessed conflicts across 3 continents, looked up at her. "I'm fine, madam. Just waiting my turn," he responded steadily despite the slight tremor of his hand, as Anna glanced over his intake form revealing symptoms like heart palpitations, shortness of breath, and dizziness. Classic cardiac warning signs. Grew more concerned. Nevertheless, his file was designated as low priority in the triage system, probably because of its unremarkable presentation and the constant influx of more visibly critical cases. "How long have you been waiting so far, Dawson?" she asked after checking the timestamp on his paperwork. "About 3 hours," he replied without complaint. "I understand there are folks worse off." Anna's trained eye noticed what others had overlooked: a slight bluish tint to his fingernails, an almost imperceptible wheeze in his breathing, and a clammy sheen on his forehead, symptoms that should not be left unattended in a waiting room. Without hesitation, she fetched a wheelchair for him. "Let's move you to a quieter spot, sir. I'd like to check your vital signs." Without objection, Henry allowed her to assist him into the chair and wheel him beyond the waiting area through the central triage section into a small private observation room, typically reserved for patients who have already been admitted. She skillfully connected him to a monitor and noticed with concern his irregular heartbeat and decreasing oxygen levels. She had just started administering oxygen when Dr. Patel hurried in, followed closely by Linda Hargrove, the hospital's administrative director. "Nurse Brooks," Harv's voice sliced through the hospital's ambient noise, tense and commanding, "you're not authorized to prioritize this patient. We have VIPs waiting, and our protocol is clear." Anna remained resolute. "He's showing signs of cardiac distress. He couldn't just let him collapse in the waiting room." "That's not your decision to make," Harv responded frostily before calling out for Dr. Patel. "Please assess the patient immediately." Turning back to Anna with controlled anger, she said tersely, "Nurse Brooks, I need a word with you outside." 20 minutes later, Anna found her access badge deactivated. She was accompanied to the staff exit and suspended without pay, awaiting a complete review of her breach of institutional protocols. As she made her way to her car, the burden of perceived injustice weighed heavily on her shoulders. Not for an instant did she regret what she'd done. News of Anna's suspension circulated through the hospital as swiftly as a contagion. Nurses gathered in break rooms, their voices low as they talked about the incident. Many empathized with Anna. However, only a handful voiced their support openly. "You can simply ignore the entire system," remarked one experienced nurse. "There are rules in place for good reasons," another quietly countered. She was just trying to assist someone in need. The response came swiftly, and now she could lose her job over it. Was it worth the risk? That question lingered unanswered, but revealingly so. In a system prioritizing adherence over empathy, acts of kindness had turned into calculated gambles. Meanwhile, back in room 114, Henry Dawson's condition had stabilized under Dr. Patel's care. Although initially annoyed by the breach of protocol, Mr. Dawson quickly recognized that Anna's evaluation was correct. Had been in the early stages of heart failure. The swift action likely averted a significant cardiac event. "You're fortunate that nurse brought you in when she did," Dr. Patel remarked while updating his chart. "You were on the brink of serious trouble." Henry nodded, maintaining his military demeanor. "Even in a hospital gown." "Where is she?" "The nurse who helped me." Dr. Patel hesitated, unsure how to respond comfortably to this question. "She's no longer on shift," he replied cautiously. "Did something happen to her?" Henry persisted, intuitively sensing there was more behind Dr. Patel's hesitation. A young nurse in the room couldn't hold back. "They suspended her for helping you," she blurted out, glancing around anxiously. "She went against protocol by bringing you back ahead of schedule." The lines on Henry's weathered face deepened as his expression hardened. Dr. Patel spoke decisively, aiming to close the discussion. "Hospital policy means she got into trouble for assisting me," he said clearly. "I'm sure it will be resolved." Once the medical staff departed, Henry remained seated quietly for several minutes, his thoughts drifting through decades of memories. He had witnessed this pattern before. Righteous individuals facing consequences for their integrity. It happened during war and persisted in times of peace, just as it seemed to be occurring now within the hospital walls. With measured actions, he retrieved a small leather notebook from his jacket pocket. The book's pages were weathered, filled with names inscribed by a hand that had grown shakier over time. Names of men from his unit in Vietnam, friends who had perished or survived only to pass away later on. Towards the back was a page featuring just one name, and an occasionally updated phone number spanning 5 decades. Lieutenant Matthew Hale. However, Hale had long since been promoted. He was now General Matthew Hale, boasting for stars with offices at the Pentagon. Henry hadn't dialed this number in years, as there hadn't been any need to do so until now. As he punched in those familiar digits, his mind drifted back to 1969, to relentless monsoon rains and mortar explosions, and recalled a young lieutenant desperately needing help due to a shattered leg during intense hours spent navigating enemy territory towards extraction safety. The call connected. A professional voice came on the line. "General Hale's office." Henry spoke with a steady and clear tone. "This is Master Sergeant Henry Dawson, retired. I need to speak with the general." Surprisingly, it wasn't long before another familiar voice was heard, older now but unmistakable. "Dawson, is that really you?" said General Hale. "It's me, sir," replied Dawson, I'm calling because someone needs some support today. They might have set kindness aside thinking it ended to read that loyalty once earned remains unforgettable. If you're feeling weighed down, leave a comment with the word unfair. Meanwhile, over in the administrative wing of Riverside Memorial, things had settled into their usual afternoon routine. Linda Harrow found herself immersed in a budget meeting, where she was clarifying to department heads why certain efficiency measures were essential. In contrast, every seat in the emergency department's waiting room remained occupied by patients shuffling uneasily on rigid plastic earth. The first sign that something out of the ordinary was occurring came when security radios suddenly burst into life with activity. Soon after, the unmistakable rumble of vehicles with government plates arrived at the main entrance. At exactly 4:37 p.m., as if on cue, the automatic doors parted and a four-star general, in full dress uniform, entered the hospital lobby. He was accompanied by two aides, whose posture and movements exuded years of military discipline. Following closely were two more officers, carrying briefcases adorned with the Department of Defense seal. Conversations ceased abruptly. Staff frowned mid-task, while patients looked up from their phones, suddenly sensing a significant change in atmosphere. General Matthew Hale, his chest displaying an array of ribbons and medals that reflected more than 40 years of esteemed service, scanned the lobby with the seasoned gaze of someone adept at rapid assessment. He quickly located the information desk and walked over with determined steps. "I'm here about Master Sergeant Henry Dawson," he declared authoritatively, his voice exuding high command, as well as inquiring after the nurse who treated him. The receptionist blinked repeatedly, clearly caught off guard by his presence. "I'll contact administration immediately, sir," I said. In just a few minutes, Linda Harrow emerged from her meeting, with a professional smile fixed on her face as she made her way to the lobby. Behind her followed both the hospital's chief of medicine and director of public relations, looking equally concerned and bewildered. General Hale Hargrove welcomed him warmly by extending his hand. "This is an unexpected honor," he remarked. "How can Riverside Memorial be of assistance to the military today?" The general did not accept his handshake. Instead, he inquired about the whereabouts of nurse who assisted Master Sergeant Dawson earlier that morning. The assurance in Harlow's expression wavered momentarily. "I'm concerned there was a procedural issue that the nurse." General Hale, his voice cut through the lobby's silence, capturing everyone's attention. "She prioritized what truly mattered over bureaucratic obstacles. That nurse saved the life of a man who had once bravely carried half my platoon to safety under enemy fire, despite being injured himself." He then gestured to one of his aides, who stepped forward with a document in hand. "She will be promptly reinstated with commendation." The aide presented Harrow with an official letter on Department of Defense stationery. As she read it, her face paled visibly. "This is," she started to say when General Hale interrupted to complete the thought, "an official reminder that in line with federal policy set by the Veterans Health Priority Act, all facilities partnered with the VA are required to recognize and address the service and needs of every verified veteran, without exception or delay." He added that their hospital enjoyed considerable federal funding through this partnership. The chief of medicine advanced and addressed the general. "General, I want to assure you that we deeply value our veteran patients. There was merely an issue related to protocol." The word protocol lingered in the air, as the general echoed it thoughtfully. He recalled a young sergeant he once knew who bypassed standard procedures to evacuate a wounded lieutenant from a battlefield. despite orders to hold for extraction. Had he adhered strictly to protocol, I wouldn't be here today, he reflected solemnly, allowing his words time to resonate with their audience before continuing. Sometimes following protocol can endanger lives. That nurse understood this truth and acted accordingly. On the third floor in room 114, Henry Dawson Saturday watching local news. On a small wall-mounted television, although the sound was muted, he didn't need to hear it. Footage from the hospital lobby revealed everything he needed to know. A faint smile crossed his face as he nodded to himself and murmured, "Still got it, Lieutenant. I'm mourning." The story had spread like wildfire online. Nurse suspended for helping veteran general intervenes became a trending topic across social media platforms. News vans lined the entrance of Riverside Memorial as management inside worked frantically to manage the situation. Anna Brooks was not just reinstated, but also received a formal apology and a promotion, lead emergency response nurse. Additionally, she was tasked with creating a new training program focused on protocols for veteran-sensitive care. In an effort to bounce back from the PR crisis, hospital administration introduced a new policy called Veteran Priority Response, or the Henry Dawson Clause, which guarantees expedited attention and specialized care for verified veterans. 2 weeks later, when Henry was ready to be discharged, it was Anna who arrived to escort him out. His heart condition had been stabilized thanks to medication and a minor procedure. His prognosis looked promising for someone of his age. As they headed towards the elevator, Henry mentioned that he'd heard about her upcoming award from the American Nurses Association for integrity under pressure. Anna gave a modest smile and said, "I was just doing my job, Mr. Dawson," he responded by gazing up at her warmly. "No," he insisted gently, "you saw me as more than just another elderly patient or a mere chart. It's uncommon to see that now." As they approached the hospital entrance, the afternoon sun illuminated the American flag waving above the parking lot. Henry saluted it as he had countless times before. "Thank you for earning it, sir," Anna said softly. Henry gave a knowing nod. She referred to more than just her work or his treatment. He responded, "Some things are always worth fighting for. If you believe true honor remains untarnished, consider subscribing to the Unbreakables."